There's a specific illness caused by a virus called flu or influenza that we should spend a little time on talking about that specifically. Now, influenza is the official term for the virus that causes a respiratory infection in adults and children. The term flu, we kind of throw around somewhat inaccurately. Someone has a stomach flu, or I feel terrible, I have the flu. Technically, flu is short for influenza, which is a respiratory illness caused by a virus. Antibiotics do not take care of the flu. It's a virus, and again, antibiotics only cure bacteria. This is caused by a virus. However, for the influenza bug, for flu, we do have specific antiviral agents. They're like antibiotics for viruses, antiviral agents that can help with this in specific instances, and we'll talk about how they work and when they work. Influenza is seen most commonly in the fall and the winter. There's a bit of a wiggle zone for where that is. Sometimes it's a little earlier. Actually, more and more it's becoming a little later, even into the spring. But influenza, this true flu, tends to happen sort of fall, winter, and maybe early spring months. And it's spread exactly the same way as a cold is, which is basically in particles that you sneeze or cough into the air or touch onto a surface. And it can live there for a while, so it's very important to cover your mouth when you sneeze or cough, and you do it into the crook of your elbow, not with your hand.
Exactly. So what are some signs that an older child or an adult may have the flu? Well, the first is a higher temperature. They may have a headache. They're going to feel profoundly tiredness. That seems to be a predominant feature of this infection. A cough may or may not be present. They may have a sore throat, a runny nose, body aches. Diarrhea and vomiting are very common in very young children that have the flu.
But not so much in older kids and adults. It tends to be more of a respiratory total body feel terrible.
It's more than just having a cough or cold. It's a profound respiratory infection, a bad cough with a high fever that tends to be the hallmark of the flu. Now, what are the treatments? We alluded to this a little bit. The first is dehydration. You want to prevent dehydration. Again, encouraging fluids. Kids don't need to eat when they're sick, but they need to drink liquids. And we talked about some things like Infolite and Pedialyte, good ways that children can get rehydrated and fun ways to do it, such as popsicles. Fever medications, such as acetaminophen or ibuprofen. And then specific antiviral drugs. These are going to be prescription from your physician, and they work specifically against the flu virus. They don't work against the common cold viruses. If we could only find the cure
nothing that
to the common
to cure
cold.
the virus itself.
But if your doctor thinks you have the flu, and they may do a rapid test, a nose test that they can send off to the lab to say, yes, you have the flu, or no, you don't have the flu. If they think you have the flu, or you have a positive test for the flu, and it's within the right time frame, they may write you for an antiviral, a medication specifically against the flu virus.
Right.
Again, this would be something your doctor would decide if the age of the child and
situation.
It could only be within the first couple of days of the illness, that kind of thing.
The best thing about the flu, honestly, the best thing to do about the flu is prevent it. Once you've had it, even if you get that special antiviral pill that Maureen was just mentioning, all it really does is shorten how long you're sick. It doesn't make you not sick. You still end up with the illness. You just have it for a little less period of time. And actually, those pills only work if you take them within the first 2 days of the illness. So if you happen to see your doctor the third day or take your baby to the doctor the third day, it's not going to work at all. So the best thing really to do is prevent it by getting a vaccine. And we have every single year a flu vaccine that's tailored to the flu that may happen that particular year. So anyone who's around an infant, who might be a caretaker for an infant, a parent of an infant, should be getting the flu vaccine. And actually all children over the age of 6 months should also be getting the flu vaccine. So it's something that everyone, caregivers, as well as the child, him or herself, should be getting the vaccine itself. If you want information, the Centers for Disease Control and Prevention, the CDC, is something you can actually look up on the internet, and you can go ahead and put in your search engine CDC and flu, and it will pull up all the information you might be interested in about the vaccines for the flu and how flus are going that particular year. If you think your child has flu symptoms, the most important thing really is make sure they're hydrated, and then give your pediatrician a call and see if these medications, like these antiviral agents, might be indicated.